Well, the pain went away, so I'm fixed, right? Well, probably not. How many times have you had perhaps injuries over the course of your life? Maybe it was something that happened 3 months ago, 3 years ago, or maybe 30 years ago. You were stiff, you were sore, you were really not feeling well for a few days, maybe even a few weeks. But then, guess what? Your body did what it's supposed to do. It healed itself, and you started to feel normal again, at least for a period of time. And what you believed is you believed that everything was okay. Why? Because you weren't having any pain, so it meant your body fixed the problem, right? Well, not necessarily. Based on some of the research that's out there, they find that if and when you have an injury, not necessarily blood, broken bones, bleeding, or all this sort of stuff, but we're talking about micro damage on the inside. Ultimately, yes, your body is going to try and heal, repair things as much as it possibly can. However, if it's trying to resolve an issue that it's not quite able to fix on its own, it's going to heal, but it may not heal exactly the right way. I want to use this as an illustration. Imagine that you break your forearm. Well, is it going to heal if you go to the orthopedist or not? Well, it's going to heal whether you get your arm cast or not. The problem is that it may not necessarily heal the right way. And so what's the purpose of seeing the orthopedist? It's to make sure that when it heals, it's going to heal the right way so that you can restore and get as much function back as possible. But pay attention here. If you've ever broken a bone, how long was it actually hurting for? A few minutes, a few hours, maybe a few days, but it took weeks for that thing to actually heal. And that's to heal the right way. What if you make the presumption, oh, it's not hurting anymore, therefore it must have healed the right way, so I need to keep going back about it. What I'm saying here is that that is not always the case. Want to run a little experiment? Try this. Get a heavy book bag or something like that, and what I want you to do is go into your car and put it on your passenger seat. And if you've got a newer model vehicle, what will happen is the little alarm bell is going to start going off as if you have a passenger who's not put their seatbelt on. And it's going to keep going bing, 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 like that for probably about 60 seconds. And then guess what it's going to do? It's going to stop. Does that mean that that book bag is not there anymore? No, it's not. But it means that the sensor stopped putting the alarm bell off. Why? Because you weren't doing anything else about it. It's often similar in the body. When we initially have an injury, your body is giving you warning signs that there's pain, pressure, proprioception, tightness, problems in the body. And it's like, whoa, okay, this isn't feeling really good. Hey, you probably should do something about this. However, as the body starts to do some of the repair work, even if you haven't done anything about it, it's going to start to make certain kinds of chemical changes, which are ultimately going to dampen that alarm bell signal. And the consequence of that is you're actually going to start feeling better, not necessarily because anything is fixed yet, but simply because your body has stopped sending the signal to let you know that there's a problem. It's had to make a shift. It's had to make a compensation. It's been able to adapt for things in that one moment of time. But that's just that one moment in time. What would happen then in the case of the arm? Your body's able to compensate, but are your surrounding muscles, your ligaments, your joints, your nerves, they're all now going to have to start doing extra work that they were never designed to do. And they may not break down overnight. It may take days, months, weeks, years, even decades. But ultimately, if there are these small problems, given a long enough period of time, even if you are, quote, feeling fine the whole time, they can surely be building up bigger and bigger. And down the track, you may be saying, oh, okay, I'm starting to feel more pains, more pressure, more discomfort, more problems, and you might even attribute it to just getting older, when the reality is it's the result of an old situation that did heal, but not necessarily the right way, and your body's been having to compensate for it ever since. Now, even if it's been there for years and decades, that doesn't necessarily mean that there's nothing that can be done. You see, your body continuously is repairing itself and is keeping doing that, keeping you alive until your absolute breath. The question then, are you doing everything in your power to help your own body take as good care of you as it possibly can? So here's my challenge for you this week. And this one does take a little bit of thought. Firstly, I want you to think about some of the more memorable injuries that you experienced over your life, particularly the ones that you think, wow, I can't believe I got away with that. And you'd be amazed what people forget, whether it's sports injuries, car accidents, or things that can sometimes be even more severe than that. Think back at the things that you think that you may have gotten away with. And now what I want you to do is I want you to look at your present health circumstances, particularly areas and parts of your body where things are not quite working as well as they used to be. There's no guarantee of this, and this is not meant to diagnose you, but it's possible, simply it is possible, that there can be a link between your current health circumstances and things that happened in the past. And even if we don't have a time machine to go back and undo that damage, there's nevertheless opportunities and things that can be done right now to improve your current circumstances. So have a look at both the past, the present, and then ask yourself, what are you willing to do in order to help improve things? So that ultimately the person you are 1 and 10 years from today can be even better than the person at the present. So good luck with this challenge. Thanks for watching this video, and we'll see you next time. This is Dr. Jeffrey Hanna at Atlas Health, where it's all about hope, healing, and well-being from above, down, inside, and out.
For more information about upper cervical care, please call us on 3188 9329 or visit us at atlashealth.com.au.